Come in.
Good morning.
Hi, good morning.
Are you ready?
I'm so ready.
Are you excited to be the first doctor to do our 73 questions video?
So excited.
Let's jump right into it. How did your morning start?
Wake up at 4 a.m., do a little meditation, think about the things I'm grateful for, then a quick trip to the gym, cold shower, then go to work.
What's on the agenda for today?
Enjoying life.
What are all the different surgeries you perform?
Uh, I pretty much do everything from reconstructive to cosmetic surgery for the breast and body for patients of all ages.
Which one is your favorite?
Uh, I really enjoy when we're able to combine surgery that help patients with physical limitations like reconstructive surgery, along with really good cosmetic results. Like breast reduction surgery would be a good example.
In your medical training, what is the longest surgery you've performed?
Oof. Um, has to be somewhere between 18 hours or so, something like that.
Wow, what was it?
It was a very complex. Um, I can think of a few, but typically long surgeries like that are very complex cancer reconstructions in which we both do the excision of the cancer and then reconstruct it. For example, this one that's in my mind is a poor gentleman had, unfortunate gentleman, cancer in the throat. So we had to remove it and then reconstruct it with different parts of his leg.
Yikes. So, where did you grow up?
I grew up in Colombia, Bogota, Colombia, until I was 16. And then my family and I moved to Cocoa Beach, Florida.
Do you miss the warm weather in Florida or do you enjoy the cold winter months?
Oh my God, I miss the warmth. It's 90 degrees right now in here.
If you weren't a surgeon, what would you be doing?
Scuba dive instructor.
Aside from work, what do you enjoy doing?
Anything outdoorsy. Uh, Hiking, running, mountain biking, surfing, anything in the water. Yeah.
Do you have any hidden talents you want to share?
Bike and juggle.
Can we see it?
Give me a few things and I'll do it for you.
What makes your consult process different?
Well, we really try to get to the why of surgery. You know, why are patients really coming to us? And also, I really believe not, one size fits one. And we really try to tailor our surgical approach and the way we can help patients to that individual patient.
How can someone schedule a consult with you?
Super easy. Call, email, text us. We're here.
What is the average healing time for body surgery?
4 to 6 weeks is pretty standard. Mhm.
What would you tell someone who is on the fence about getting surgery?
Um, Honestly, if how you feel inside is not what things look like on the outside, and there's something that we can help you with in a safe way, that's the time to think about plastic surgery.
With all the different hats that you wear here at the Williams Center, do you find it hard to have a work life balance?
Not really. I think very early on, since college and medical school, I've made it a big point in my life to have good, you know, work-life balance because really being happy in one makes you happier in the other one, and having a good balance really helps me take care of my patients in the best way possible.
Now, be honest. What is one thing you aren't good at because it seems like you have so many talents?
um, Scrabble.
What is your least favorite thing about the plastic surgery industry?
uh, the way media, um, Hollywood, and especially nowadays, social media portrays plastic surgery. I find that things are overly exaggerated, and some of the things we do are not portrayed as best as they could.
Do you think the media and celebrities will ever change the narrative around plastic surgery?
I hope so.
What are three words your friends and family would use to describe you?
Hmm. Dedicated, caring, and with a very sarcastic tone, they would say I have a great sense of humor.
What's a joke that proves your great sense of humor?
um, oh, I have so many. I'm a big fan of dad jokes. Um, like, what's the best time to go to the dentist?
When?
2:30.
Okay, rapid fire. Are you ready?
Yeah.
What's your favorite vacation spot?
Dominica in the West Indies, in the Caribbean.
Favorite color?
Green.
Do you have any pets?
Yes. Golden Lab. His name is Mahi.
Favorite season?
Summertime.
Favorite food?
Seafood.
What's your zodiac sign?
Virgo.
Last rapid fire question. Where do you see yourself in 10 years?
See myself here as my home base, and then hopefully also helping a community in the Caribbean who are in high need of plastic and reconstructive surgery. I've always been really big into mission work and helping those who are not as fortunate as I am. So I definitely want that to be part of my life.
Will we see a Williams Center in St. John one day?
That's the dream.
How many surgeries do you typically have in a day?
It all depends. Sometimes it's a few big surgeries, sometimes it's many little ones.
How many surgeries do you have today?
Today, four.
When you started in plastic surgery, were you ever squeamish in the OR?
No, I was never squeamish, actually.
Do you have any advice for people who may be squeamish but want to become a surgeon?
Good place to start is watching videos online, and then maybe one, if that's okay, still uh, watching like a small little procedure, and then kind of work your way up to the bigger surgeries.
What type of music do you listen to while performing surgery?
Um, I have a mix titled Alfredo Surgery, which is over 40 hours of everything from the Bee Gees to Whitney Houston to country to rock, everything.
Is that the same playlist you listen to in the car?
Sometimes I do, yeah.
Now we know you're a big country fan. Did you grow up listening to country or was it something you picked up listening to on your own?
I actually picked it up when my family and I moved to Florida. I started hanging out with friends, and they used to listen to country, and it's actually very similar to some of the traditional types of music that I used to listen to in where I grew up. So that's what it reminds me of. So that's kind of where I took it from.
Do you have a favorite country artist?
Alan Jackson and Kenny Chesney.
Have you been to either of their concerts?
Just Kenny Chesney once, yeah.
What made you want to come to the Williams Center for your fellowship?
I really wanted to go to a place where there was a combination between a very well-run practice with an excellent team and top-notch surgical care and results.
What made you want to specialize in the breast and body?
Breast and body is an area that really gives me the opportunity to combine functional surgery, so helping people feel better with functional deficits that they may have, as well as cosmetic surgery, so helping people look better as well.
What's one thing you wish every patient knew before surgery?
Uh, Really, that I honestly treat every one of my patients like they were my sister or family member. I do my best every time.
Which surgery that you perform is the most challenging?
Um, Different surgeries, different challenges. No two people are the same, and that's why here we really try to tailor the surgical plan according to each individual person.
Do you prefer your surgery days or your days in Rejuva?
um, that's like asking your kids which one's your favorite.
What kinds of non invasive work do you do?
I focus mostly on injectables, Botox, fillers, things like that.
What skincare product should everyone have in their skincare routine?
Sunscreen for sure.
Which sunscreen is your favorite?
Elta MD.
What does your skincare routine look like?
I have to. It's pretty basic. Um, Usually a nice cleanser followed by something like vitamin C in the morning and a moisturizer, and then a night cleanser, um, an active product like retinol, and then a moisturizer.
What do you think a misconception is about the cosmetic industry?
Um, I think that social media, Hollywood, they tend to portray cosmetic surgery as overdoing things as things that don't look very natural, where that's a big misconception. Things can be done in a very natural way.
Do you work out of our Saratoga office as well?
Yes, I do.
Have you had any fillers or Botox?
I'm way overdue for Botox. Yeah.
Hello, Dr. Lloreda.
Oh, hi.
After a long day at the office, what is your favorite way to relax?
uh, I like to go for a long run. Yeah, that definitely does it.
Do you run for distance, time, or just an open goal?
Different days, different times. Usually, I like to challenge myself, so either distance or speed.
It's a Friday night and you want to go out to dinner. Where are you going?
Uh, 550 waterfront is always a good choice.
What would your whole order be?
Um, Seafood, anything seafood.
Now, we know you lived in Florida and there is a Chick-fil-A opening up about 20 minutes from here. Are you excited?
Yeah, I am actually.
Are you excited that these questions are almost over?
Oh no, I'm so sad.
What's the latest you've ever left the office?
um, Probably midnight
Are you a morning person or more of a night owl?
morning for sure. I usually wake up at 4.
Are you able to fit breakfast, lunch, and dinner into your busy work schedule?
Yep, I usually have breakfast and lunch, and then I fast until the next day. It's intermittent fasting is good for you.
We are down to the wire on questions and want to ask some questions for future professionals. What would you say to someone who is on the fence about going into a career in plastic surgery?
Try to spend as much time as you can with plastic surgeons, different plastic surgeons, and picture yourself in their role and see if that's something you see yourself doing.
What is your favorite inspirational quote?
It's from Rocky Four already. Um, Going one more round when you think you can't, that's what makes all the difference in your life. Mhm.
If you could go back in time and tell your younger self one thing, what would it be?
It would be definitely to live a little bit more in the present, especially my younger self, and spend as much time as you can with family and friends while you have the time for it.
Did you always know you wanted to become a surgeon?
I always knew I wanted to go into the sciences, and then towards the end of high school, I figured medicine and surgery was it for me. Yeah.
How did it feel to complete all of your schooling?
Well, it's been a little while, but yeah, it's great to be practicing surgery as an attending. Yeah.
What's one piece of advice you would give to an aspiring surgeon?
Balance is key. Um, Having a good work-life balance, but also mental, physical. It only makes you better at everything else too.
Final question. How would you rate this experience now that it's completed?
10 out of 10.